And in medical news, the Drug Enforcement Administration made the stunning announcement that it would allow consumers to return unused prescription medications to pharmacies. The agency wants to reduce stockpiles of unneeded painkillers and other medications from homes across the nation. It says these potent drugs are a temptation to teenagers. According to a study by Partnership for Drug-Free Kids, more than 70% of teenagers say it's easy to get prescription drugs from their parents' medicine cabinets. And in other medical news, a new study focuses on identifying and treating autism as early as the first 6 months of life. Arise News medical contributor Dr. Aletha Maybanks is here with that story and more. Hey, Aletha, it's
Hello.
good to see you.
Good to see
We're
you
going to
too.
talk about this autism study in just a minute, but let's get to a couple of other things first. This one is interesting but not surprising, but a little bit surprising, and that is the dangers of sitting for so long. Tell us about this study and what it found.
Right. So we've had several studies actually over the last couple years and understanding and really recognizing this danger in sitting, and usually it's related directly to cardiovascular health. This particular study actually followed 11 men who were not obese, the ages 20 to 35, and there were two phases. So the first phase is where they actually sat in a chair for 3 hours with literally no movement. But then their blood pressure was taken around their leg, looked at the pressure of the femoral artery, which is the large artery through your leg, and then they also used an ultrasound to see what was happening to the artery. The second phase was then they allowed the men every 5 minutes or every hour for 5 minutes to walk on a treadmill. And so what they noticed is that for the men, for the first phase of it, where they sat for 3 hours, no movement, that there was actually impairment to the artery. And they could tell it by ultrasound as well as by the blood pressure. Compared to when they were able to go for every hour, 5 minutes, there was no damage at all.
This is astounding because when you think about it, 3 hours sounds like a long time, but how many of us sit for more than 3 hours every day, especially if you have an office or a desk job?
The average American sits for 8 hours every single day. So it's how do we build into what we do on a day-to-day basis to either time ourselves and make sure that we're getting up at least on that hour, because what they notice that these men sat there for 3 hours, but they noticed this damage after 1 hour.
That is absolutely correct. So what's the takeaway here? That means we're just not supposed to sit down for very long at any stretch?
Absolutely. Whenever I do, I do a lot of meetings and a lot of presentations, and if people have sat down for a very long period of time, I get them up and get them moving.
That's incredible. That'd be bad news for a lot of long-winded preachers at church who do want you to sit down for a long time.
Well, they could start incorporating some, and we're working with institutions as well, and faith institutions, to start encouraging them to get people to stand up during whatever needs to be stood up.
That would be good news for my daddy. Okay, let's move on to this other one. And the implications are really crazy here, and that is some very common drugs that now are believed could lead to Alzheimer's.
Right, so benzodiazepines, and just a list of them are Valium, you've heard of that, Ativan, Klonopin, lorazepam, Xanax, all of these that we use usually for anti-anxiety or even sleeping have been found that if people, and so they looked at actually 1,800 seniors and adults who actually were diagnosed with Alzheimer's, looked back at their records from 5 years previous to 10 years previous and looked to see who was taking these particular drugs. And they noticed that those who were taking these about 3 months period of time had a 50% increased risk of having Alzheimer's. If you were taking it 6 months consistently, even a greater risk. So the length of time as well as the amount of the benzodiazepine increased your risk for Alzheimer's.
I just have to ask this question, and are we sure it's the drug that is related and not the underlying reason for taking the drug?
Well, it's a great question, and that question was posed, but they really feel because of the timing of looking past the 5 years and then to 10 years, that they feel it's actually more the causation of, and not completely confirmed as if it's causation, but more the causation that it's taking the benzodiazepine and leading to the Alzheimer's.
Certainly something I'm sure that requires more study and taking a harder look at it.
And with so many people having Alzheimer's, and it's increasing not only just in this country, but worldwide, definitely a lot of attention here. And do we have to have more of a public health approach through the recommendations that we have with prescribing benzodiazepines?
All right, well, keep us posted on that. And then finally, we want to make sure we have time for this. And this is a story that made the news earlier this week, the last couple of days, and that is this little teeny tiny study that said early intervention with infants could reverse the signs of autism.
Autism, right. So definition of infants, let's clear that, less than 12 months of age and up to that. But as you're right, it is a small study. It was only looking at about 7 infants from the periods of 7 months to 15 months who were diagnosed with autism. From that particular time. And what they noticed, they had an intensive kind of therapy for 12 weeks. It's both the therapist and the parent. And by the time these children reached 2 to 3 years old, they actually had language skills equal to other 2 to 3 years old. So,
yeah, the implications are really astounding, but it brings up a whole lot of questions. First of all, this is a very small study, so that means a bigger study has to be done. But also, I did not think that children were diagnosed definitively with autism until they were much older anyway.
Right. So convention, we've been around 3 to 4 years of age is the typical diagnosis that we've been kind of working with and what most people have been thinking. However, this is kind of the push of the medical community to really think through, should we be diagnosing Alzheimer's, I keep saying Alzheimer's, autism.
And looking at me, what you trying to say, Aletha?
Autism earlier, because they do show symptoms. We call them positive signs and negative signs. Positive signs in which children become very visually fixated on not people but objects, like a fan spinning, even at that young of age. And then negative signs of not having normal developmental skills, such as saying bye or smiling, that we typically see in an infant. So there are signs and symptoms at that age. And so the thinking is that maybe we need to start diagnosing earlier so that these children can actually be treated earlier so that they can start to catch up with other children.
I'm just about out of time, but you're a pediatrician. This is in your sandbox. Does this give you reason for help? Does it intrigue you?
Absolutely. Oh, absolutely. Anytime, especially with the numbers of children increasing who have autism, diagnosed with it, if we can get earlier, if we can get them treated, then absolutely. The challenge will be, is the treatment accessible to all children?
Yeah, indeed. All right, we'll leave it right there for now. Dr. Aletha Maybank, thank you so much.
You're very welcome.
See you next week.